Trevor. How are you?
I am wonderful. How are you?
I'm good. We're going to get started soon. I usually wait till promptly on time. So,
Okay, that is wonderful.
do you have that button in the upper corner?
Yeah, I said I hit it. It says requested.
You don't have to request it now. Beautiful. Perfect.
So you're going to control it?
I'll control it for the first few slides, and then when I'm give it to you, you'll take it over.
Okay.
Trevor, I'm going to give it just a couple of more minutes. A couple of people just texted me, and they're getting started. So,
And no worries.
right. Hey, Trev.
Yes, sir.
Welcome, welcome everybody, to our first Talar Tuesday in a very, very long time. Uh, for those of you who used to attend when we did this during COVID, it was a way of trying to promote community, introducing Talar Medical to everybody, and trying to add value to your clinical practices. And it's time to do that again. There's been a lot going on, and we've kind of been watching and deciding that we want to um, communicate and share some things with you. And so we're launching our first Talar Tuesday. We're going to be starting doing them once a month. And depending on the participation, we may look at doing more. I will tell you that everybody's on mute except for myself and our guest, Trevor Kruder. If you have any questions or comments, please type them in the chat box and I will read them to Trevor after he finishes his presentation. And we will try and answer all the questions. And if we don't, I will get back to you with an email with answers to the questions that were asked that we didn't get a chance to answer. So again, welcome. Thank you for taking time away from your families and joining us tonight. So tonight we're going to be talking about, revolutionizing podiatric recovery with some cutting edge peptides. We're going to talk about advanced peptide therapy for joint and tissue regeneration. This webinar is going to be taped. You can access it on the Talar Medical website. Please don't worry about jotting down notes or taking messages, as this webinar is going to be archived and you will have no problem having access to it. Just as a quick thing, those of you who are not familiar with Talar and are attending because of the great topic that we're talking about, Talar Medical is the only podiatric GPO in the United States. We were started in 2016 by my partner and I, Jeff DeSantis, with a goal to be able to help out podiatric practices, not just by getting them the best widgets and the best prices, but by educating everybody like we're doing tonight with peptides. For those of you who have not had a cost analysis done, we charge nothing for the cost analysis, and we don't charge anything for our membership. You can get a no obligation cost review. You can send us a list of products in an Excel file. Some vendors already do that. You can send an email to our admin at talarmedical.com. If you can't get the Excel sheets, you can send in invoices. It may take a little longer, but we're here to try and show you some value and bring value to your practices. Tonight's speaker is Trevor Kruder. I can tell you from personal experience that meeting Trevor has changed my life. I currently am taking 6 peptides and have been recovering from knee replacement surgery that required 3 procedures. One time I got septic and I'm at my lowest weight in years and I feel completely different. But Trevor is the CEO. He's the founder and visionary of Alpha BioMed Industries. He discovered the power of peptides after healing a tearing bicep and helping cure his mom's cancer. He lives and breathes the biohacker and health optimization lifestyle. He spent a decade testing peptides for performance, health, cognitive, and other benefits, and built Alpha to power over 2,000 clinics and brands. Alpha Bio is the #1 manufacturer and distributor of peptides in America, with the exception of Big Pharma. People think about, why did you partner with them and why did Talar partner with Trevor? I partnered with Trevor because when I met him, I think that his mission and his company's mission is very, very similar to what we wanted to do with Talar Medicine to help transform practices, and also what we do as healthcare providers to help transform their lives. So the mission for Alpha Bio is to transform life through peptides. And I think that you're going to hear all about that and see Trevor's enthusiasm when he talks about it. We've tailored some stuff to go towards the podiatric applications. There's probably 250,000 peptides out there, and we're probably going to focus on maybe a top 10 that would probably be beneficial for you and your patients. I also loved the vision that Alpha Bio had. And I will tell you that from a clinical perspective, Trevor's laboratory was probably one of the first to do what's called third-party testing. Trevor tests his product when it comes in the office. He tests his vials when they come in the office. After the products are tested, he has them tested internally, and then he sends them out to a third-party tester. As providers and healthcare providers, you're going to have access to be able to print off the third-party testing, so you actually can show your patients and that you're giving them the best quality, because a lot of the times these products that are out there, and you're going to see a lot of wannabes coming into the space and selling you stuff for very cheap, and you just need to learn. And I think Trevor's going to really educate you on all of that. I just thought it was very interesting if you look at where peptides are going and the trends that are happening. It is a huge growing market. You can see that it was $117 billion in 2024, and it's expected to grow in between 2025 and 2030, 10%. They expect it'll be almost $250 to $300 billion business. There's a prevalence of cancer, metabolic disorders, and a variety of different things that patients are encountering. This also gives you the opportunity to do nutraceutical instead of pharmaceutical treatments for your patients. But I'm going to turn it over to Trevor and let Trevor speak. So, Trevor, thank you very much for joining us on our first Talar Tuesday in 2 years, and it's all yours.
Thank you, Ira. I appreciate it. As always, it's a pleasure. You still have control. So do you want to just click through for me or?
I can, but I thought it. Did you request permission from me?
Yeah, it says needs to be granted. You have not
Uh,
granted me access. But
I
until you do
am.
so, I can tell a little bit about who we are just really quickly. So, yeah, I was unfortunate, but fortunate enough to get into this space by injuring myself. I tore my my left bicep head off of my right bicep, and I was going to have the other side ruptured, reattached, lose half the bicep, anchored through the bone. And I decided to see if there was something else out there before I made that decision with the orthopedic surgeon. And I just luckily had known somebody that was really big into the growth hormone space for years. And I use growth hormone BPC 157, TB 500, which is probably the biggest combo that is out there today, and what you'll probably use mostly in your facilities if you choose to run with the peptide game. And it re-anchored itself on the bone, and I've never had a problem with my right biceps since. That sparked the interest, but it took years. 7 years of the last 10, 11 years were really just me talking to people about them. They thought I was crazy. And we really ramped up really over the last 3.5 to 4 years when the space became more friendly because of the GLP-1 market that is driving most of that massive $150 billion that you're seeing there. However, the rest of the industry and the rest of peptides have grown tremendously. We only had 12 peptides. Not that we only had 12 peptides in the world. We've always had about 200,000 of these running through our body, but we had 12 peptides that we knew how to make. And we knew what they did because there wasn't a ton of research. Insulin being the first about 100 years ago, we discovered insulin. That's peptide. Human growth hormone is peptide. And the list goes on and on and on and on. And we started figuring out that instead of using medications to, different drugs to manipulate what the body's response is to repair, we could actually just use what the body already knew how to use to repair. And whereas, medications generally can do the trick, and there's a lot of great ones out there. But there's always some kind of side effect because you've altered or chemically changed something in order to create a response that triggers maybe something negative down the road. And that's where the kind of the current medicine that we see is a beautiful thing and a disaster all at the same time. Is you're fixing the problem at hand, but you go from one medication to 3 to 7 to 10, and by the end of it, you just got a counter full of pills, and you're trying to treat everything. Peptides have a use, and they only do that use. They don't really create any negative responses. I mean, there is temporary. Sometimes you hear about nausea with GLP-1s, and you hear about maybe headaches or swelling or a little bit of pain, but overall be all, they're not really considered a dangerous product because they're naturally occurring and they are in and out of the body in such a short amount of time that they don't really cause any permanent damage, even if you take massive amounts of them. And to the point of that, it's the, things like BPC, I'll reference that one again because we're going to talk about it in a minute, but the normal dose is less than a milligram, up to 1 milligram a day. Very, very small. It has a 4-hour half-life in the body, and the dosage before you see a really triggered response that could be negative is right around 22 grams, which there's 1,000 milligrams in a gram. So you need roughly 44,000 times the normal dose. So I don't know if anybody's going to inject about, 14,000 bottles in themselves, but I highly doubt it. So they're very, very safe. And we've done everything in our power to make sure that we are 100% compliant in every single way. We function under GMP facilities, we have drug manufacturing capabilities, and we have our licensing. We have FDA license, DE licensing. We cover all the bases. We have product liability insurance, which pretty much nobody else in the United States has on all research and non-research peptides. We do actual real research. I have roughly $100 million invested into many different projects, including how to make a lot more of these more orally available. The bioavailability is complex when we're talking about these. It's destroyed through stomach acid, but we know how to get through that. The real hard part is the first pass through the liver. That destroys peptides as well. So, or converts them into something else that won't do what you're trying to get them to do. And we think we have a way to help fix that because we've been able to do it with a few other smaller molecules, but we're working on the peptides. So maybe some really big breaking news in the next 60 to 90 days as we start seeing some of the human trials come back that we've been working on. All right, so
I can't pass it on. So you just tell me when you want me to change.
yeah, no problem. So, why peptides? Let's start here. Like I was saying, very safe, profitable to you as the doctor. These are a cash pay item. They are very affordable compared to what the market sees them deemed at. A lot of people don't know how to use them yet. So your education and your ability as a physician, doctor, and the authority in medicine really holds a lot of weight with a lot of people on the planet. A lot of people are already going out and just getting themselves because they don't require a prescription because they're not FDA approved in that sense as a drug because they're not a drug. However, they are approved as for you to take as a research product, which is where this whole entire thing started years and years and years ago. And the legislation is changing. And in order to keep that compliant, even in states where maybe this isn't allowed, states like Ohio have always had a challenge, California challenge. We've actually created all approved HIPAA compliant programming that you could literally go on, order. We take all the liability away. We actually take the order, transition the order. You guys have a HIT compliant pathway to talk with your patient. Everything is, encrypted. We then send them their products, and then they can go ahead and use them. So, the NLBLs, you really don't have to worry about anything with any issue with the pharmaceutical board or the drug manufacturing or anything else, and we're covered. So let's move on to where we're going with what we have here. And I apologize about this. This is my 5th training today. And I've been on the phone all day. Let's go to the next one. All right, so these are going to be some of the main ones. And we manufacture over 290 products at this point. We have about 25 orals. So some of these, like we see GLP-1, which is your base was semaglutide or Ozempic originally. That is transitioned to tirzepatide being the largest in the market with Mounjaro, if you know that name. And then you hear a lot about now, if you're in it, retatrutide, which is a triple agonist, which included glucagon onto it. That will be hitting markets, I believe, through FDA trials and officially approved in early spring next year. However, there's already many past that. So I was actually making retatrutide 3 years ago. So it's very old news to me, but very new news to a lot of people. Now there's bioglutide. So that is a quad agonist. We've grafted IGF-1 onto there, and that is now actually orally bioavailable. So we are figuring out some of these. There's a glycerin, which is a amylin-based product that's not a GLP-1, but it does shut down appetite. That is now oral. And there's a lot of others that we actually have in there as well. So there are plenty of different options. Survodutide, mazdutide, liraglutide, there's a lot. Now, as far as let's just talk about the general category because it's your pick. You can pick which ones you want to use with your patients, what works best. In general, GLP-1 being semaglutide is just the single agonist. It is very, very, very effective, but it's also very, very, very rough for most people. As being the original, the effectiveness came in the fact that it shuts down your brain as far as that food noise, but it also shuts off or brings out the sugar and glucose levels of the blood. But in doing so, it created a lot of nausea. And that was a huge, 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 huge knock. A lot of people now I got to stick myself with the needle, which is scary for a lot of people. But on top of that, I also risk being sick for 2, 3, 4 days sometimes. The newer products have virtually eliminated that by lowering the amount of GLP-1 is in that molecule base. And we've included things like GIP, which helps fill the stomach with more acid, slows down the digestion process to physically actually make you not as hungry, right? And then glucagon, which is your natural sugar source of the body. And that mechanism actually creates a thermogenic effect, also a slightly increased heart rate, but it also allows the body to have a lot more energy. So for people that are really trying to lose weight the right way, which is you still want to eat, you do not want to eliminate your metabolism by not eating. That's not good either. It's really about understanding the patient and changing lifestyle and habits. Retatrutide allows you to eat, but you get full quick. And it's more of like you snack throughout the day. And snacking is good. You're constantly just releasing small amounts of insulin, not massive drops from, sodas and ice creams and things like that, along with that thermogenic effect. And the brain has more power. You have more energy. You're able to go to the gym. You're able to think. It's really a really great product. And the bioglutide, now the oral ones, we make about 6 right now. They are all effective, but they do hinder that stomach reaction because you are trying to absorb and go through the gut. So just know, even though there are ones that are newer or supposedly better, as far as comfortable for the human body, most people still want to stick to the GLP-3, which is retatrutide. It's the easiest on the body overall, and it does actually lose the most weight. It's just you still have to stick with the needle once a week. Why is this so important to you? I mean, let's be honest, feet, knees, all these different parts of the body, and diabetes are a big portion of it. Is if you can get people to drop that weight and get their type 2 diabetes in check, we've seen full reversal of type 2 diabetes, along with GLP-1s, MOTS-C, some of the other products that we make that help increase mitochondrial function, along with that glucose control and several other things. We've seen it completely reversed and going away. So probably going to be probably the biggest demand as well, and your biggest moneymaker. Most doctors generally range in the 2 to 4x range of what they pay. So if you're buying something for, let's say, $80, that monthly to you is somewhere between $3, $4, maybe even $500 that you're charging your patient, plus the visit, plus those other things that might be important that they might need as well. And that's cash. That's money going into your pocket. You're doing a service for the patient. They actually want it. And a lot of them are already going out and they're going to find it somewhere else if you're not doing it. So since you're already dealing with a problem, it's easier to keep everything on one roof. You're able to monitor the patient all the way through the process and also monitor the weight. Now, we can go through the slides. I know that the slides aren't nearly as important to me. You can always look at those later. I'm just kind of giving you what your patients are looking for and what we see mostly out there. So NAD plus. NAD is, that's FDA approved. Same thing with the GLP-1s. They are very, very, very well known and demanded. NAD plus is an entire body molecule. It's not actually technically a peptide. It's a coenzyme. We grow this and ferment this out of bacteria and E. coli, which sounds very strange, but what we got from this is NAD plus is this activation in the brain, and that creates RNA repair, DNA repair, mitochondrial response, energy boost, more attentiveness. And when the brain is working better, it allows the brain to actually work with your muscles, work with the other pieces, and increase, let's call it, muscle development, cellular repair, whatever it might be. What's also nice about it does a lot of other really fun benefits that your patients might like on top of it, like it cures a hangover. So if you have a massive hangover, you can actually do a shot of NAD and clear the hangover within minutes instead of hours, if not the entire day, by opening up those synaptic pathways. This is not going to be the ultimate repair, though. So even though it does all these things, this is a very slow repair. It's just going to help. Think of it as the cherry on top. But as a cherry, it's one of those cherries that, for someone that this is something you could be on all the time. I take it Monday through Friday. I take a small dose. You do not need to IV this. If you do want to IV it, do it very slow. It's a usually 3 to 4 hour process for people. It can be done intramuscularly with a insulin pen. You're just going to do anywhere between 50 and 100 milligrams. They can do that once a week, twice a week, however much they want. Like I said, you don't like burning out receptors. I'm always going to tell you lower and slower than anything you're going to hear from Big Pharma or any other places, because I'm a big fan of being able to use these for the rest of your life and getting the benefits for the rest of your life. Whereas some of these medications that when they came out, like the GLP-1 semaglutide, they started people at a higher dose than what was really necessary, and they auto titrate them up. Well, if you're losing weight and it's effective, why are you going to raise my dose? But that's what they're having you do. Now you have an entire population that is essentially addicted to a product because they are maxed out on the dose. Dr. Ira Krause is one of those people that was already maxed out on the dose, and we had to spend a lot of time resetting his receptors so that he could actually use the products in the correct way. And there are ways around that for people. We can always talk about that later. That's why we developed the amylin-based products like congrilotide and I can say this, agluferin, the oral, because it allows the hunger response to eliminate, but it's not doing anything for your sugar side of it. So, but you can back down the GLP and they don't get nailed by the food noise and they just start eating like crazy and put the weight back on. So let's go on to the next one. So MOTS-c, and I talked about this earlier. So MOTS-c is a mitochondrial function peptide. This peptide is what your body produces when you work out or do anything with exertion. And it basically triggers the response from the brain to the nucleus to fire up the mitochondria to create energy inside the body. And why is this important? Well, we as a society do not move nearly as much. And this is why we're seeing energy levels, tiredness, and a lot of other things happening. And there's other things linked to this as well with brain function and so forth. But for this, it really is important for type 2 diabetes because that activation inside the mitochondria helps with things like insulin sensitivity in some levels. It creates movement, which also helps when we all know that type 2 diabetes is directly linked to poor diet and lack of exercise. So with this being able to get people more energized, hopefully we get them into better habits, whether that be, walking, running, or just even getting to the gym and lifting light weights. All of it's going to help with overall weight control and many of the other functions. And plus, it will also help with them when you're getting into the workout phase for recovery, if they are going through some kind of recovery treatment and center. Those can be challenging, and the body working to repair itself pulls so much energy from the body. This will help give it about 30% more, believe it or not. And this is very simple. You can run this 4 shots 3 times a year, and it does activate that recovery response and that response from the brain to the nucleus for close to 3 to 6 months. Now, if you're fighting through an injury or you have type 2 diabetes, it is more like a 3-day a week, not necessarily forever, but maybe months in order to help reverse some of those type 2 diabetes effects. Next one. We already talked about GLP-1. So the S is for SEMA, T for tirzepatide, and R for retatrutide. And like I said, that's kind of your step up each way that you go. You're going to lose about 15% body weight on semaglutide, about 20% on tirzepatide, about 25% on retatrutide. All the numbers that are coming out right now for bioglutide, the quad agonist that is oral, is somewhere around 16 to 18. So it's right around a tirzepatide type loss, but being an oral. I'll tell you right now, unless someone is deathly scared of needles, a once or twice a week insulin shot into belly fat is probably the easiest thing on earth. In fact, most people don't even know that you've done it if they tell them to look the other direction. So there really isn't any stinging or reaction as well. It's a very harmless effect when injecting, whereas some of the other ones which are not on here, like follistatin and SS31, can be, or epithalon, they're highly acidic. So they do burn quite a bit when injecting. And then also follistatin being a full protein at 344 aminos long, the response from the muscle tissue is to reject, causing pain pathways. So next one. All right, so BPC, this is, we do a combo called the Wolverine. It's been around for quite some time, and it got the name because if you've ever seen the movie Wolverine from Marvel, basically you could shoot the guy, cut his arm off, whatever it is, and he just starts healing immediately. Now, does it really go that fast? No, but I will tell you right now, you will probably see in some cases 3 to 4x quickly people recovering. I had broken my neck years ago, and once again, this is all documented. You can check medical records. This is not some made-up story, but I went to a chiropractor and I had my C6 snapped in half and I ruptured 4 discs. I was in extreme pain. I had to have 2 surgeries. First one was because they didn't realize how bad it was, and then I had to go back in with the neurosurgeon and have the entire C6 rebuilt, and I have titanium disc implemented in my spine. They gave me 6 to 9 months, most likely 12 months. to recover. No more than lifting less 6 to 8 pounds, no carrying anything, nothing above my head. I was running BPC, and the big thing is you want to start taking this before surgery. There's already an injury. This will help with bringing down inflammation before the surgery occurs too. But BPC works on inflammation, muscle, bone, tendons, ligaments can all be repaired. We can regrow ligament and tendon tears. Now, full ruptures generally don't get worked. I was very lucky with my bicep, but you can grow these things. So I was actually golfing in 6 weeks, which really pissed off my doctor, but I was fully healed. I was released from rehab after one session. They literally look at me and they go, there's no way you should be feeling this good or being able to do this, after 4 weeks, because I went in after 4 weeks. I went in for fourth week. I went in for the fifth week. I was there for 5 minutes. And they're like, get the hell out of here. There's no reason. Granted, I am in pretty good shape. I was not nearly in good shape then. It's been a long road of me doing exercising and changing my habits, but I was at one point about 50 pounds overweight, 28% body fat, and I used a lot of the things on here to get my weight in check. And now I, sit between 3 and 7% body fat year round eating ice cream. It's kind of funny, but BPC is the most powerful product to take. It also helps with a lot of things, gut health, brain repair, you name it. This is good for you. And like I said, it doesn't have any side effects in the body. For people that are going out of surgery, I always suggest morning and evening though. So maybe a 0.5 milligram morning, 0.5 milligram before bed. Why is that? Well, one, in the morning, it's going to help them with the inflammation as they get going so that they don't have as much pain and they can get their day moving. I think we all can attest that in the morning after you've sick or surgery, the hardest thing is getting out of bed. And then when you get through that initial point and your body is moving, you start feeling better. Everything kind of starts working. But when do you really repair? It's when we sleep. So you want to take this right before bed to get that massive repair control in the evening as well. So it helps on both sides of the stick. Next one. Now, TB500, which is going to be, this is the Robin to Batman kind of thing. TB500 is massively, massively stronger in the inflammation category and promotes the actual mechanism for the healing purpose. The thing about it is, though, it does not work on tendons and ligaments and those types of pieces. It is really more bone, soft tissue, and inflammation that it heals. Now, why is this important? Inflammation just ruins the ability to get in there and work, or for the correct blood flow to get in there and actually get in there and do the repair in the body, especially in areas that don't have very good blood flow. I kind of look at this, people, your normal patients won't really understand, but if you have, let's just say you have 10 cars that are repair cars running around your body, and they're out there like, oh, there's an injury, we got to go over here. There's an injury over here. And you have a massive injury. It's like, oh, you only got 10 cars. Well, you might need 100 or 1,000 cars to get in there and start healing. You only got 10. So putting BPC in the body is like giving yourself 1,000 cars instead of 10. So they're going to be in there, but now there's a traffic jam in that spot. It's trying to get in and heal, but it can only do so much. But whenever it can fill up and get the dead material or whatever out, it pulls it out, and the next one's there ready to go and waiting. TB500 gives you 20 lanes instead of 2. So the cars coming in and out, in and out, in and out, in and out, causing that really massively repair rate. Now, we do make, like I said earlier, that product called the Wolverine. That is really good for generalized recovery. Oh, I tweaked my ankle, or, oh, I pulled my hamstring. Running Wolverine, shot in the belly, is going to help repair that pretty darn quickly. However, when you are dealing with something as serious as a surgery, it is 2 different protocols. In order for TB500 to be the most effective, it needs to be in a much higher dose. It has a 3.5 day to 4 day half-life compared to a 4-hour in BPC. So injecting them at the same time at a very low dosage, it helps, but it's not what it's really meant for with that kind of recovery. So with BPC, like I said, you're going to want to do morning and night. And then when you talk about TB500, 5 full milligrams twice a week, as evenly as to 3.5 days as possible. And what this really does, it's like throwing a actual like Vicodin or whatever at a migraine compared to a baby aspirin. Yeah, it's great. You gave me a baby aspirin. You can't give me a baby aspirin once a day and expect my migraine to go away. I need the whole hit at once. And that's when the BPC can get in there and really start the repair process. So just know there are different ways to run these products based on the problem. We do give everybody that's in here and part of Taylor, whenever you sign up and you link in, we do have a website called the Peptide University. Within about a week and a half, you're going to see 7,000 chapters of information. Now, I know that's a lot. You're probably not going to want to dig through it, but you are also doctors. Maybe you do want to dig through that. But things like BPC, we have 70 pages of information. Good luck finding more than 5 anywhere on the internet, right? But good news is we also do have AI that is just linked to what we have in there. So you can go in there and ask it direct questions, and it will try and help you as much as humanly possible or AI possible on what it is. And you can always refer to you can always get a question over to me if you have any concerns with it. And like I said, just so you know, there sometimes are side effects. We all have them. Like I was born with epilepsy. Not my fault. I just was born with it, right? Someone's born with type 1 diabetes. They don't produce insulin peptide. Some people have nut allergies. There is a very, very rare possibility that someone may have an allergist. Now, we have not had any deaths. But if you do have someone that develops maybe a minor rash or whatever, if you have them on a lot of different things, it's hard to tell. But there is sometimes, if you have them on a bunch of medications, sure, they could have an autoimmune response to something. It's very rare, and it's not life-threatening. We've never seen anybody. But there are also side effects for some people like testosterone, which is a product that uses for growth hormone release, which we'll talk about in a minute. About 4% of the population does have an autoimmune response to it because, and like I said, nothing life-threatening, but they just get an itchy rash in the area. So there's other products they can use in response to that or that are different from that will avoid that from happening. But these ones, BPC, TB, GLP-1, very, very, very safe across the board. Very little that we've ever seen. Next one. Okay, so the blends. I'm not going to go completely into all these, but what you're going to see in all these testosterone or CJC. That is what's called a GHRH, a growth hormone releasing hormone. Growth hormone releasing hormone is going to help upregulate for about 45 minutes in the brain through the pituitary your natural growth hormone levels. And why is that important? I've been on human growth hormone ever since I injured myself years and years and years ago, before we ever knew how these worked. I would have much rather chosen this route. You technically get a much better response. So for me to inject 5 units of growth hormone, I might see my level raised from a 125 to close to 400, which is incredible. Your healing, your repair rate, your sleep, your anti-aging, all is going to be massively better at that level. I see people that have never touched any of this stuff use these blends and hit 575. Now, you don't want to carry people above 600. That's when you could start seeing side effects, but it's also not nearly the same as synthetic growth hormone because your body is naturally making its own. It understands what this is. It's coming from internally your own body. You're not forcefully injecting a synthetic completed peptide into the body for that mechanism. So whereas when you go through human growth hormone, where you might have 3 to 6 months of swelling of the hands and feet, numbness, backaches, tiredness, all sorts of funny things that can happen. None of them, once again, life-threatening, but there's a good 2 weeks I couldn't fit my feet in shoes. And I couldn't get my hands to close because my fingers were so fat. Those are very few, and if they are, they're very minor in general with these. And if you do get that side effect, that means you have a really good response rate, which is amazing. And you can take an even lower dose. Now, usually you want to start in these right around 0.5 milligram and maybe take them up to 1 milligram of your GHRH. For CJC, it is a much stronger product. It's 300 micrograms to 0.5 milligram, but I see people when I've taken 1 milligram for weeks on end, and you're fine. But that is the main part. Then ipamorelin is your GHRP, which is a growth hormone releasing peptide. It helps release the growth hormone from other areas of the body and also helps basically enhance the GHRH in its working. Why is this so important? Well, the mechanisms in our body, they all work together to achieve a goal. The more that you have working in the same arena for a cause is going to obviously help that process much, much, much faster. So whereas, BPC and TB are going to really help with inflammation, your growth hormone is going to really, really work on actually rebuilding that tissue faster, and also quality tissue. We're talking about, lean muscle fibers woven together, not water fluid enhanced loose muscle tissue, denser bones. Just overall, the injury is going to be much, much, much faster. And then when you go into, so the two X's are going to be your alters. You have CJC and ipamorelin, and you have tesamorelin with ipamorelin. Now, why tesamorelin is the leader in this? A, it's FDA approved, but B, it's also a big benefit is the studies have shown that it really helps with visceral fat. Now, I will tell you this as well, that there's only been one study on GHRHs to show visceral fat. There's nothing that says that CJC will not cause that same reaction, but it's just been proven that tesamorelin can be used to reduce visceral fat on human beings, which GLP-1s do not do that. You get a little slight thermogenic fat, but there's more from tesamorelin that actually helps melt that fat off the body. I think you're going to actually see that from CJC. It's just no one spent $50 million proving it, unfortunately. Maybe if I'm a billionaire, trillionaire someday, I'll do it for free and let everybody know. But we're pretty sure we're safe. Then we have the 3X blend. What you're going to see here is MGF. Now, I know you're all doctors, and forgive me if you're an idiot. We all already know this, but the way that growth hormone, so you're going to release growth hormone you cannot eat around that because growth hormone is susceptible to insulin. Insulin will destroy it. So whenever you have anybody on any of these products, make sure that they're taking them right before bed is best. That's when you produce some of growth hormone, but also you're not eating. So and try not to have them eat a bowl of fruit or juice, or take juice to bed or a soda, do their injection, because the sugar and the insulin release from drinking a soda before bed is going to go in and just negate what you just did. You're just flushing money down the toilet. It's not going to hurt you. But when you do release growth hormone in that 30-minute to 1 hour period, it cycles through the liver and gets converted into IGF-1, insulin growth factor 1. That is your overall what you want in the body to create that repair response in that building. MGF, mechanism growth factor, is the chain off of IGF-1 specifically linked to healing. So we are just adding a small extra boost of stimulating satellite cells in that area and burst cells, stem cells, in the growth area. So now, how much does it do? Enough that, once again, when we're talking about this, every little bit helps. I don't know about you, but I was very happy to be golfing in 6 weeks instead of a year. And granted, who knows if I ever would have recovered all the way without these different things. So they are slightly more expensive, but they really aren't. When I say slightly, I'm talking about maybe $5 or $10. However, to the patient, that could be $50 or $100 more for you to charge. So there are, all I'm charging you for is the slight increase of what we're putting into that bottle. We're not charging you for all the science and all the million bottles that I've flushed down the toilet trying to do all these things. Now, in the beginning, yes, this bottle was $150 a bottle. Now it's nowhere near that because we've already recouped that money from the research. All right, and then the 4X, which is the next one. This one is for people that actually have trouble eating. I know you deal with elderly in a lot of cases. And like my mother, she just doesn't eat. She's gone through cancer. She's gone through chemo. She's done all those things. Now, I've cured her chemo. I was on the news for it. They left her for dead. That's a whole different story. But we did an entire method and deleted 8 tumors in about 3 weeks. And one of the things that she just never recovered from, because the first 2 stents of chemo before I got her back and did it my way, destroyed her eating. She was down to about 87 pounds. The GHRP2 massively has a massive ghrelin response that creates appetite. So this is really good for people that need help eating. And then, unlike all the other ones where you do them at night, this is one of the few ones that you want to do once or even twice a day in order to create appetite. So small doses, maybe in the morning. They want to hold off from eating as long as they can, but they will be starving within about 30 minutes and then they can start eating. You'll get enough of that conversion that they're going to get the repair rate and all that good stuff, but then they also get that massive appetite and they can get some food in them. Okay. Next. So suggested cases, and this is like just a little cheat sheet. I can literally go on for hours on different methods and whatever you wanted to go into, but pre-surgery BPC and TB500 are absolutely great. Like I said, small dose, do not overdo it. I would start 2 weeks before the surgery. Otherwise, they can be running these things for longer. TB500, I generally say, in order for you, because it is a long-acting peptide in the body, you don't want to run it for more than 8 weeks. So if you think the recovery time is going to be 2 months afterwards, 2 weeks before and 6 weeks after, you're probably going to see them completely recovered before they ever finish the TB500. However, if it is going to be a long recovery, shoulders and so forth, which is not what you do, but there are surgeries that take much longer, or people are taking longer, give them a 1 month break, at least on the TB500. You can continue to run BPC 157. Okay. KPV is great. We didn't talk about it. We do make a blend called CLO. That's GHKCU. That's very good for collagen production. I think it's in every freaking women's facial cream now. It helps regrow hair, nails. It eases joints, skin elasticity, releases wrinkles. KPV is in that when we combine the two, you get all that collagen production. It really helps with the scar tissue and the building of your skin and bringing that back. So if people are very scared of scars, or there's awareness of scars, it's really hard to say, well, it would have been this big if we didn't do it, but it has shown to really help with sealing up wounds faster. Sometimes wound care, I know that with diabetes, it's really hard to heal, some of that hole that develops on the bottom of the foot. With stem cell exosome, which we also do, that's a whole different conversation. KPV really can help with the activation of getting that healed, and you can inject that right into the foot. All these products can be injected. Now, I will say this, TB500 you want to keep away. Put that in the belly every single time. And the reason why, you're not going to hurt anybody or make it worse, but TB500 does create a slight inflammation response in the injection area. So nothing that's going to be catastrophic, but if you're trying to pull inflammation out, just keep that away from the injury. All the other ones directly in is good. And then there are a couple others here because you do have neuropathy issues. There's another one that isn't on here yet. We just finally made. It's called R290, but BDNF, it's actually P21 is the peptide, but that actually helps regrow nerves and helps with neuropathy. So look at those two items. And there's another one called cerebroliacin that's gotten a lot of headway a lot of places. Unfortunately, our government decided to shut it down. That's probably the best you can get if you want to find it out there. But what we have here, P21, dihexa, and like I said, ARA290 are really help with nerves and neuropathy.
Trevor, I
Yes.
think that was the last slide, and I do have some questions that I wanted to
Yeah.
give to you that people have put in, and hopefully, if there's any additional questions that we don't get answered, we will get back to people. Just out of curiosity, one of the questions that I received was, are you seeing what other specialists are you seeing using the peptides in the practice of their patients? I know personally some of your bigger clients, but I know that
Yeah.
especially when we relate to the surgical procedures that we do, and even the non-surgical, the tendon repairs or the tendon tears or the muscle strains. What other are you? Is this something that people are going to look at us like we're crazy?
No. So 3-4 years ago, absolutely. But I think everybody here has probably heard a lot about these, and if you don't know enough, that's why you're on the call. And other ones are just they want to see what you're getting into. But you put 2,000. I have over 28,000 doctors in my network, and that's inside my network. I white label and private label for over 100 companies. I don't even know how many they have. So I could be in 30, 40, 50,000 doctors' offices right now. Every type of practice is using this. I was just on the phone with, a menopause doctor. I was on the phone earlier today with the sexual health doctor. I was on the phone with a neurologist for boxers and all the different head trauma cases for athletes. Huge doctor in LA that just treats all those problems. We obviously work with weight loss. We work with chiropractor. We work with rehab. There's virtually no one that we can't touch. Now, the products we talked about are very specific towards you, but like I said, I make over 290 different items. And we do have a lot of other cool things. These are the injectable versions. We do have oral strips, we have nasal sprays, we have transdermal, like microneedle patches now that show some efficacy in spot healing. And like I said, I have a ton of research and development going on to some other really cool things with, making a lot more of these even more orally available. But, anything with longevity is huge. Clotho is going to be massive. I just produced FOXO4 last week. So we now have FOXO4, which is huge for cancer and overall longevity of the body. Humanin, that's a peptide and regulator that is found in more people over 100 than anything else. They generally produce massive amounts of humanin. So like anything that you're trying to shave down and not just live longer, but live longer healthier, that's what we work on. It's every part of the body. You have 200, like I said, you have 200,000 of these in your body. We know what 2,000 of them do. The other 198,000, we're still trying to figure out. We might know that they're over here floating around doing something in the arena of maybe healing or brain, but we're trying to figure out what they actually do. If we get into cancer, I have over 600 peptides that we're trying to figure out. PNC27, PNC28 just came out. We're seeing tumor shrinkage and tumors not be able to grow when running up for over like 2 to 3 weeks. Completely stops tumor growth in certain forms of cancer, from colon to breast. There's just so much going on. I could probably talk for 6 weeks with the information that's out there, and it's all about us going out there and providing proof of how they work. The good news is like I said, the ones that you're looking at, these have all millions and millions of people that have taken and proven that they work, and studies abundance. Now, unfortunately, in America, because of what we do, we don't release a lot of that data here, but it is 100% out there. Go ahead and start scouring. Millions of people are on these products and seeing it.
Trevor, so we talked about BPC 157 and we talked about using it for muscular healing and a variety of different things, and the joints and everything. But I know that you've talked about the difference between oral versus injectable. And I know, for example, a lot of people are, even I've seen some webinars recently where they're marketing oral BPC 157 for tendon repair. Can you explain the difference to people about injectable versus oral with like BPC 157?
Yeah, so BPC was from the gut. We found it there. That is what helps regulate and protect your gut. You have toxic waste, sludge, sewage, battery acid going through your stomach. BPC is what's in there repairing all that damage so fast that you don't die. We figured out by taking it out of the gut and just putting it in the body, it will get back in there for sure, but it will repair and regrow a tendon because it's just looking for something to fix. That's what his job is, has a job to fix. When you take it orally, it goes, oh, I'm home. It stays there. It does not leave. Otherwise, it would already leave and repair your shoulder or your knee anyway. But no, you just put it right back in its home. It will not do that. And like I said, the other big thing is, unless they have a technology that I don't know about, and most of them lie, because I say, okay, great, show me proof in the pudding, show me blood studies, all that. I have those coming. I am spending, like I said, $2.5 million on studies right now to get blood results from human beings, proving that it's in the bloodstream through an oral surface. No one will do that. They're just a bunch of BSers. When it comes down to it, they never give it to you. But when you put it in there, it does not go through. You would need it to get through the stomach, then get into the intestine and leave the intestine to get into the blood before the liver, which would kill it anyway. Oh, do we lose?
It was my fault. Sorry.
No worries. I was going to say I was going to look in here. What else you got that you wanted to ask?
What else did I get? I wanted to ask you, how quickly, Trevor, if we're using this on our patients, I know you talk different time frames, but in the limited ones that we're using for podiatric medicine, what is the how quick fast are patients are we going to notice these with their patients?
Within days, if not hours, sometimes. In general, what you'll see is people that take um, BPC and TB500 react within 1 to 2 days. It's that quick. GLP-1s within a day. I know people that take it in the morning, they can't eat by the evening. Definitely by day 2. And like I said, there are different levels. I always say start low. You can always increase, but if you go too high, you have someone puking up for 2 or 3 days, and no one wants that. So start low. If people are still having a lot of food noise, just slightly increase the dose. You only need to eliminate the food noise. You do not want people sick. KPV is wound healing, so you're not going to really see. You just have to believe what's going on. But the structure of what the peptide does is it directly is linked to that process, so it should help. Human growth hormone, those generally take more like a week to 3 weeks, depending on the person, but they will start feeling, they'll sleep better right away. I mean, that is probably the biggest one. If you don't dream, I always have this fun with people. Like, I know people, I never dream. Go do a shot of CJC, testosterone, whatever. I guarantee you have the most vivid dreams ever. You are so deep in sleep, and you really only need 5 or 6 hours on it because you're in delta right away. You fall asleep hard. And those are the ways you can really tell. And otherwise, go do some blood results. You will see IGF-1 spike. That is a direct link that it is working and producing growth hormone in the body.
One of the questions, Trevor, was providing a list of different things. I want to just let everybody know that anybody that signs up to work with Talar and Alpha Bio, we have put together some podiatric protocols. We do have lists of the different treatments. There is going to be a recommended dosage guide. And then you also have the availability of reaching out to whether you can reach out to me and I get the information from Trevor or somebody on Trevor's team directly.
Yeah,
Our
we have a
goal
full
is to
sales
provide
team.
you. Yep, there's a full team. We have somebody who I work with very closely on Trevor's team that's been very helpful. So we'll be able to provide you with all the information. We'll give you marketing tools. We'll tell you things that you can say and things that you can say when talking about peptides in your practice. So, like I said, we're not just selling you peptides. We want to educate you. We have waivers for if you want to have your patients sign a release in the office, just like you would do for a toenail procedure. We have some forms that you can take and work with your own personal healthcare attorney and make sure that it fits your needs. So what we're doing here with Trevor is not just offering you the ability to have peptides, but we're trying to educate you on how you can use them and make you feel comfortable with your patients. Trevor, one of the questions I got, are there any clinical or medical conditions that you are aware of where some of these peptides might be considered inappropriate to use?
These ones, not so much. But yeah, when you get into some of the brain ones, if you're on a serotonin production drug for depression, you generally don't want to take things like tesofensine with it, right? Because they're both SSRI related. Things along the line. What else? There really isn't a ton that react that way, but there are a couple. You'd have to specifically maybe throw a couple of them out, but no, they're not drugs, and all we're doing is slightly amplifying the body's natural process or giving it the process. I mean, I have the same name as you, Trevor. He was here last night. He was born without a pituitary gland. So if they didn't find that, he would have been never grown. He didn't produce any growth hormone. He's 6'4". They caught it early and they inject him, right? That kid's been on every drug you can think of, or less. He can never come off. There's no interaction, right? Because it's just what your body would normally already have. Now, like I said, you may have an autoimmune response every once in a while, but nothing that's going to kill anybody. And when you do it, you just stop that and you just know to move on to something else. You may have an itchy rash for a couple of days, but it does go away. Now, when you get into PT 141, which is also an FDA approved for sexual health, you can have the same thing as like Viagra or Cialis, the 8-hour erection, right? And same thing for women, because it works for women, which is unique. They can have a very intense, you know,
Yeah.
stimulation in that area.
Um, so I know that we talked about a lot of the peptides that you have that are combined, like you have your blends, you have the Wolverine. But if you're injecting multiple different peptides, can you combine any of these in one injection, or are they each done as a separate injection?
So a lot of them you can do together. I like to say try and keep things in the same realm. So, the brain ones you can move together. The recovery ones are usually okay together. NAD you don't want to really mix with anything because NAD has this conversion because it is a coenzyme that it can start converting into what's called NADH, which not that that's not a good product. It's just it does a completely different thing. It creates massive amounts of energy. So a lot of people actually make NADH and combine it with B12. But for the recovery and that part of the entire body help with the RNA DNA expression, you want to run it by itself so it doesn't convert
Uh, Trevor, are you aware of physicians utilizing peptides in conjunction with, let's say, a PRP injection?
all the time. Yeah. Now, okay, so there are some things that may slow down with some work. So you look at exosome PRP stem cell, they sit in areas, stem cells harvest in the lungs for 4 to 6 months, right? Now they react or they have a job to do, and they're going to go based on maybe say the injury or inflammation or whatever you're doing. When you take something like BPC or TU500, you are going to reduce that inflammation response. So they may not work, that product may not work as fast, but they all are still going to work together. You just might be slowing down how fast that one item is for another to work as well. So in general, I usually say, because PRP, exosome, stem cells, far more expensive, I would say it's probably better to start with something like a peptide. Plus, they're in and out of your system for you to use the other.
Okay.
But they still will work together.
I'm going to give the last question. It's got three, so I'm going to read them. I'm pretty sure I'm going to answer the third one. The question is, can this be marketed in your website or similar, or is it just something you can talk about with your patients? And are there any handouts we can give our patients? I'm going to answer the third part and tell you Trevor and I are working on putting together trifold for podiatric patients with regards to the peptides. And Trevor, I'm going to let you talk about the marketing because I believe that there are guidelines we give them, but they should be able to market that as well.
Yeah, so every state has slightly different rules, but in general, you do not want to solicit the GLP ones due to patent laws. Semaglutide comes off in 2027, then you won't have any issues there. But you may have issues with the drug companies saying, "Oh, you're stealing their product." Now the difference is those are drugs. They have manipulated the product, even though they haven't, because if you actually dissect them down, they're not actually like I run everything through a mass spec. I know exactly what's in everything. The They haven't, but that's the only way you can classify this drug. Otherwise, it's naturally occurring. So they tweak one minor thing that really doesn't even make any sense to say, "Oh, this is a drug." So I wouldn't go blasting semaglutide or Zeptide, but you can say you carry GLP products, and if you really just want to make sure that you're in the clear, carry one name brand. Then you're fine. Someone comes in and go, "Oh, you carry GLP-1s? Yeah, I have Ozempic. Here it is." You're clear. You're allowed to say that you carry peptides, and I see people that have boards that show what they carry. However, I think it's best if you just want to play anything safe, you just say you offer peptide therapies. You're fine. Once you get in the room, the doctor and the patient privilege takes over. Even in my platform where we have the patient portal with the doctor, I never get to see anything that is communicated through there. All I get is what is supposed to be ordered and shipped out to where. That is all I'll ever see. From there, we have a billing action where we take the payment from the customer and then we wire the money to the doctor. They decide what they want to charge that person completely. The doctor always knows, or you guys obviously tell them what they're going to pay. They can charge whatever they want to that end all patient. We just end up collecting the payment in order to ease that burden. Not to mention you don't have to carry inventory if you're worried about that. Because sometimes you want to offer 50 things, but you don't want to carry 50 things, right? Or, like I said, the GLPs are the ones that really people ever get headaches. No one's going to jail or shut down unless they're actually doing something wrong, which is the guys that have, and I know two of them, they got in trouble. They were buying Chinese products, they were selling them as the name brand. And then they got busted for it. And then they lied and showed fake paperwork for their chain of custody. They completely just shot themselves in the foot. Of course, they're going to get in trouble for that. But like I said, you're not getting anything from China. Everything has a chain of custody. We have COAs for everything. We have third-party verification. We have all of our chain of custody all the way through. Even our water has COAs. Our glassware is COA. Everything we do has a COA. And like I said, we actually manufacture almost everything here, even our water and our glass now.
Well, Trevor, it's 7:03 Mountain Time, so I'm sure it's 8:03 on Eastern Time. I want to thank you very much for joining us today. It was really educational, and I will tell you that the majority of the people stuck around. It was very nice. Want to tell everybody about our next Talar Tuesday meeting on Wednesday, October 14th. We'll be talking a little bit of wound care on a new wound care product that's come on the market. It's an advanced triple action absorbent wound dressing that allows hydrocapillary flow. It's called Zalta. And then I am also going to click and give you my contact information. So anybody that wants to reach out to me can reach out to me. That's my cell number. More than happy to set up webinars with you and talk about helping getting you set up in your practices. As I said, I work daily with Trevor's team to help doctors get educated, trained, and give them the tools. So thank you for joining us. I hope everybody has a great rest of the week. Trevor, it was a pleasure as usual. Thanks for all your help. Good night, everybody.